as doctors ourselves. So I would like to propose that digital eye strain actually should have a re-nomenclature, and it should become a digital eye syndrome or spectrum. Because it involves not just visual and ocular symptoms but extraocular and other symptoms as well. So why is it that a digital device and not a book can cause strain? Because the simple answer or the simplest answer is pixels. Because the book doesn't have pixels, it has a print. Pixels are clearer in the center than in the periphery, and they lead to more of an eye strain. This is a recent conference. Let's just look at the pixels, one of the shared WhatsApp photos. So we don't even realize it, and this causes convergence fatigue. These are all the symptoms that we usually have due to digital eye strain, and we all know that. So I would again, like I said earlier, divide these symptoms into optical or visual, which may be blurring of vision, double vision, focus abnormalities, and hence accommodation related. They could be ocular surface related, and of course habitually there can be the position, the lighting, and all the other aspects, the timing, and all the non-ocular symptoms, including pain in the neck, back, shoulders, posture, even sleep issues. All these come under the ambit of the third one. Of course, this also means that the digital eye strain patient can come not just to the ocular surface specialist or the cornea specialist, who will now need to look under the ocular surface, but also to the optometrist or refractionist or the squint specialist even sometimes to the neurologist because of headaches. So the asthenopic symptoms or the strain symptoms are usually due to the convergence, accommodation, and pupillary miosis, and they include the diminished power of accommodation, distancing of the near point of convergence, and phorias. In children, they may lead more to esotropias, whereas in older people to exophorias, convergence insufficiency, etc. Of course, these are more associated with uncorrected refractive errors, and especially hyperopia and astigmatism. These are some other symptoms. We know, as we've seen in the first slide, that brightness matters, contrast matters, and screen glare also matters. There's something called screen refresh rate. If it's less, it causes flickering of the screen. There's an optimum flicker rate or the fusion frequency, which needs to be 30 to 50 hertz. Otherwise, the picture or the video comes as flickering. That itself is a very risky or dangerous thing, especially it can be epileptogenic. If the flicker is too much, sometimes it can induce autism in children. So again, we just saw also that what we call as this polarity, the dark or the negative polarity also matters. And also, of course, when we look at a textbook, we look downward. When we look at a screen, we look horizontally or upwards. Looking downwards has many advantages because it helps in the blink. It reduces the amplitude needed to blink. It completes the blink. So not just a blink happening, but a complete blink happening is important. And that reduces dryness. Also, it reduces the evaporation looking downwards, because the dryness also reduces because we're looking downwards, less of an exposed area. So, of course, there have been innovations in screen, including high-resolution screens, inbuilt anti-reflective coatings, matte finish glasses, image smoothing. Just look at the difference between an ambient light, which is dark or dim, versus brighter light, which is more easy on the eyes to see. Also, look at the interplay between ambient light and the screen light. So here, in both the images, there's a disparity. There's too much of dark ambient and too bright a screen, or vice versa. So that itself causes eye strain. Glare, on the other hand, we should not have the light from in front of us or from above us, but from the side or obliquely backwards. So this is how glare looks, and there are anti-glare coatings nowadays. Ocular surface related symptoms, of course, we know are dryness, burning, grittiness, heaviness. Blink has a lot to do with this, complete blinks, and again frequency of blinks. These are very important. So we need to blink 10 to 12 times a minute, we know that, but we do not when we are looking carefully or very attentively at screens. So this is something we need to practice and get ourselves to do more. So there's a desiccation of the tear film, and hence the dryness and the dry symptoms. So of course, There's air conditioning, which is again associated with these computers, because computers and digital screens are more placed in air-conditioned environments. There can be something as simple as a Xerox machine. The chemicals through that also reduce blink rate, as I said, incomplete blinking, increase exposure due to horizontal gaze. This is how the replenishing of the tear film usually occurs. Of course, if people already have dry eye, they'll get aggravated. We need to specially ask children or people who are using screens about use of antidepressants, because these again aggravate dry eye. So faulty illumination we've already seen, and treatment of course we know has to be multifactorial, multidirectional, and we don't need to yet throw away our computers of course, but we need to first change our habits, the ergonomical approach, we need to attack the surface, and of course we need to have any optical treatment. This is how the posture should be. There's a 90-90-90 rule. We do not need to speak too much away from the computer. There's an ideal distance around 30 inches from the computer. There's a rule for that as well. This is the rule for posture by the American Optometry Association. The 20-20-20 rule asks us for every 20 minutes to look at least 20 feet away for 20 seconds. And about the lighting, we've already seen it's better diffuse than focal. And also the ambient light needs to be matched with the screen light. As we've seen, the lighting, the position of the window and the lighting we've already seen. There's something new called the full spectrum light, which is nowadays available, the newest kid on the block. And these are supposed to be more easy because they simulate sunlight. Blue light, yes, this is the most talked about blue light, and we have blue light filters. What happens is the pineal gland and the melatonin secretion is directly dependent on this, because a blue light around 460 nanometers is supposed to be a potent suppressor of melatonin production, and hence the sleep issues through all these LED, LCD screens. So what about the distance? So we need to have the distance of the laptop around 2 feet, and this is the 1-2-10 rule, I would say. And angles of course matter, we have to look downwards, and so this strain reduces. This is mobiles at 1 foot, laptop screens at 2, and bigger screens at 10 feet. Every 5 seconds we need to blink, every 20 minutes we need to look away for 20 seconds, every 1 hour we have to get up from our place and move, because this itself is very important. Lubricating drops, of course, for the actual dry eye issues can be used, but humidifiers for the AC, some other treatments. Of course, there's some fancy things called wink glasses. Every time there's a shootout kind of this thing here, which shoots out and it reminds you to blink. And then, of course, we need to correct the uncorrected refractive errors. We can use blue blocking lenses. But more effective would be to stop using the screen 1 hour before bedtime, or to switch to the warm mode, because that helps in the sleep issues. Computer display settings we've already seen. In short, let us summarize, and these are the other factors which may play a role: the diet, the exercise, lifestyles, adequate sleep, stress control, and workplace settings. Effects on kids are not just limited to the eyes. There are language delays, impediments in life skills, obesity, diabetes. As I said, epilepsy, even autism can be aggravated. There are psychosocial risks as well. We need them to have more of green time, not just due to the screen effects, but also due to the epidemic of myopia. So our role finally is not just to ourselves and our community, our children, but also to the other doctors. Corporate awareness program, we can have patient awareness material like the one we created here from our department. And finally, I'd like to wrap up by saying that when I take a lecture on digital screen, digital eye strain for my students, they are the ones who tell me, ma'am, you are the one using the PowerPoint. And then you're telling us not to depend on this. But that doesn't mean that we have to go backward or we have to regress back to the era of the blackboard. But no, we don't have to do that. We don't have to go forward and go into robotics either. But we need to think outside the box and create a balance. So thank you.
One small question is, if we compare mobile, laptop and desktop, which one you think will put more strain?
So these are all the LCD, LED and these all have pixels. So if they are not held at the right distance, the right angle and so they will all cause eye strain.
That we know, but if we compare out of these three, because person has to use one gadget.
So the thing is that we have
If
tried
you have
to
done
find
any study on it,
that projected devices may have less of a strain because they are not illuminating by themselves. Those which are self-illuminating may have more of a strain, like these LED, LCD screens. But there's no.
in my practice, I am advising patient you should watch TV instead of seeing movie.
Because of the distance.
Because of
yes.
distance.
And also, but the thing is that again we need to have the distance of at least 10 feet. We should try and not look up because then the evaporation
Yeah,
is
that
much
is
more.
eye level or
It's
below
more
eye level.
difficult on TV because we sit on a sofa to watch the TV. So again, this is a very big thing. We had a 1-minute video made specially for all these rules encapsulated just from the patient's language kind of.
One thing also I want to add, I have studied somewhere, you should not keep your mobile near you in the night.
That's true to the radiation.
It is
and
carcinogenic.
yes. So there is so much more to in our hospital. 4 departments are really worried about the screen. The ophthalmologist, the pediatrician, because the children are language delays and a lot of other problems, autism. The psychiatrist, they've already classified digital use as an addiction, with all definitions of addiction already into it. And recently the EMR people, the physical medicine and rehab people, said there's something, the posture's gone really bad and the head is going back into ape-like, so they're really worried about it.
Actually, I can add on to it. If you find the orthopedician, people have trigger thumb. Because
And
the way people are typing, the younger generation,
yeah.
this is, earlier you would see the joint damage here. Now, people are coming with the joint damage here at a much younger age because of the speed with which they type.
Also, amongst the
Cervical
doctors,
is
the
also-
radiologists were the first to be affected because they had screen use for 6 to 8 hours as a part of their work itself.
Yes. Thank you so much.
Thank you.